So thinking about cutting my own foot off. Don't do that. Don't cut off your toes. Hey everyone. I thought today we'd do something a little bit different and it would be fun to do Reddit questions that people have posted and I'll give you guys my reactions. So the first one, so thinking about cutting my own foot off, which is already giving me anxiety. I'm a 39-year-old female, type 2 diabetic. She's on Ozempic and metformin. So when she goes swimming or is in the water for a long time, the nail softens and then lifts away. She says at this stage, I'm ready to cut them off. Don't do that. Don't cut off your toes. I would say that in these cases, doing a procedure where they take the nail off completely is actually the best bet because it will grow a healthy nail underneath, even though it might take a year. And again, there is no guarantee of success, but I would do that over cutting off my own toe. That sounds horrible. Let's move on. This is a 30-year-old female. She's overweight. She was given phentermine 30 milligrams. So she says, a few days in on the new dose, I've noticed some other mild expected side effects, but feel like I have ants crawling all over me. I'm itchy and prickly and cannot find a rash or spots. And she's got a tingle to her lips. She says that her skin is looking more golden tan. Wow. So I would say if she's having the sensation of ants crawling on her skin is feeling tingly, prickly, itchy, it could be because phentermine is a stimulant and so it can cause these side effects in some people. But a lot of people don't realize when they're on phentermine and they're not eating, they're actually also not drinking any water. So if you're not drinking enough water, that can cause some skin dehydration. As far as her skin changing color, that's not a known reaction, but I really hope she saw somebody to get that taken care of. Random heavy period. So an 18-year-old, she's had the implant Nexplanon, which is a progesterone implant that goes in your arm since she was 13. This is her second one. She had her period stop completely. And even when she was on her periods, they were very light. And she started bleeding heavily at that, and she's worried something is wrong. She said she's lost a lot of weight. She feels like that's unrelated. She's had changes in her libido, and she's wondering if that's related. So she says, should I see a doctor or do I sound fine? One, you should see your doctor because if you're having heavy bleeding that's random, you want to figure out where that's coming from. Nexplanon will cause irregular bleeding. It does take a few months for your periods to kind of regulate, and some women just have heavier periods on a Nexplanon, even if it's been their first, second, or third one. So I hope she also got into a doctor. Here's another one. Ooh, this is a good one. This is a 26-year-old female. She weighs 103 pounds. She says that because she vapes nicotine, she's rarely ever hungry. She's probably getting 1,000 calories a day. She doesn't eat a lot when she does feel hungry. She likes a very sedentary lifestyle. She's gone as low as 800 calories a day because she states she was busy. Is this unsustainable for my body? She says she's always been petite. The lowest she weighed is 85 pounds. The most she's ever weighed is 125. Yeah, that's bad. That's bad for your body. Yeah, 800 calories. I don't care how tiny you are. I mean, my kids are 4'9", and they eat more than that. 1,000 calories a day isn't really a lot, but I will note that she vapes nicotine, and nicotine is an appetite suppressant. So a lot of people who smoke or vape nicotine just don't eat a lot anyway, but that's not sustainable for your body. Also, smoking is bad. So if you're doing it, please quit. Okay, burning sensation under the left rib. All right, 23-year-old female here. She's had a burning sensation under her left rib for a week. She calls it an internal sunburn. Constant discomfort. She feels her left rib is sticking out more than the right. She went to the doctor. She got it checked out. They thought maybe just a pulled muscle. She's been very anxious lately. She's wondering if this is a stress response. Has anyone else experienced this? Now, your ribs are mobile, and not a lot of people realize this. They think that your ribs are like stuck to your spine and like they don't move. But remember that your lungs are underneath it too. So it has to have some flexibility. And your ribs are attached to your spine and your sternum with cartilage. So they're very quite mobile. And you can actually like pop one out of place. It's happened to me before and it's quite uncomfortable. I do wonder if her stress is causing her to sleep poorly and she twisted or she did something a little bit uncomfortable. But I will say, while this is common, it usually goes away with a little bit of rest, some ice, heat, some anti-inflammatories if need be. It usually goes away within a week or two. Last one, unexplained weight loss of 30 pounds in 4 months. This is a 26-year-old female. She said she's lost 14 kilograms with no change in diet or exercise. She's fine with it, but her coworkers are giving her crap about it. So she said in 4 months, she went from 75 kilograms to 64 kilograms. She weighed 61 kilograms at the doctor. She said she hasn't weighed that since she was 13. Now she's 26. She had a complete blood panel done for cancer markers, H. pylori, celiac, thyroid, iron came back normal. She doesn't know if she should see a GI, doctor, gastroenterologist, to get an endoscopy. Her primary care doctor wants her to do that. She said she had one when she was 18 because she had persistent anemia and they didn't find anything. She wants to know what could be causing this. So any unintentional weight loss usually needs to work up, right? If you are intentionally losing weight and you have lost 14 pounds in 4 months on purpose, that's fine. But if you're waking up, stepping on that scale, looking at your clothes, realizing that you're losing weight and you're not even trying, you do need to see your doctor. This woman has totally normal blood work. According to her, obviously I don't have anything to look at, but usually when you have anemia and you have normal blood work, the next sign is to get an endoscopy, which is when they put a scope through your mouth and they look at your esophagus and your stomach and they look for signs of bleeding. A colonoscopy is when they go and they look in your colon and they also look for signs of bleeding. So I really hope that she followed up with her doctor and she found a cause for this, because this is a little concerning. So this was fun. Okay, here's the thing. If you're gonna cut off your feet, don't. If you're bleeding or have lost a lot of weight, don't write it on Reddit. Please go see your doctor. Some of these were a little bit terrifying. So I'm a board certified primary care doctor. So if you have any questions like that, let's not post it to social media or Reddit. Go ahead and ask the source, put them in the comments below, and I'll make sure to get to them.